non-communicable disease has been identified as the leading cause of death around the world. They include heart disease, cancer, and diabetes, and they are responsible for 43% of all deaths in the country, deepening poverty and straining our healthcare system. In a new document coded as the NCDs manifesto, the Ghana NCDs Alliance is asking political parties to commit to some actions to address NCDs and mental health burden facing the country. In the studio with us is Labran Musa, who is National Coordinator of the Ghana NCD Alliance. Before we start this conversation, though, here is NCDs in numbers. Let's share with you what we do know so far on this. Now, for non-communicable disease, we know that 74% of global deaths are caused by non-communicable diseases. And what are these? We're looking at lung diseases, cancer, mental disorders, type 2 diabetes, cardiovascular diseases, and that our source is the World Health Organization. Now, let's again, you look at the in terms of numbers, we have 17 million people dying from NCDs before the age of 70. That's a huge number there. And already I've spoken to you about what these NCDs are. So 17 million people die from NCDs before they turn 70. Again, according to the World Health Organization, 77% of NCD deaths occur in low and middle income countries like Ghana and a lot of the sub-Saharan African countries. So let's look at the numbers in terms of the diseases. So for cardiovascular diseases, we have 17.9 million people, dying through cardiovascular diseases. For cancer, 9.3 million people. When it comes to chronic respiratory, we have 4.1 people dying every year, according to this, from chronic respiratory diseases. Again, 2 million people die to diabetes annually, and that's quite huge. Now, what are the risks associated with non-communicable diseases? So tobacco use. So they tell you that when you use tobacco, and sometimes it's even written on the pack that tobacco use is not good for your health. Physical inability. So how often do you exercise? Normally we eat, sleep, and that's it. And also harmful use of alcohol. So those are the numbers there, huge numbers, 17 million people dying through NCDs before, they turn 70. Let me bring in Labran Musa here. Labran, so since you put out this manifesto, have you had any sort of conversation with political parties? And again, what have you seen in response from these parties?
Thank you so much for having me. And let me see. Let me commend your station for the good work, especially on non-communicable diseases.
Yeah.
I was here a few days ago with your colleague, on the NCD forum. I mean, it was good. I mean, that we are continuing to elevate the conversation to a national level. So yes, indeed, this is the first time we've been doing this in over the years. And I think this is the third time we are put together such a manifesto. And indeed, once we're done, we have engaged, the major political parties and even the independent candidates as well with our manifesto. So we have sent copies to them for them to consider in coming out with a manifesto, because just as you've mentioned, the figures are very staggering, and they are growing exponentially. You didn't mention the statistics in Ghana, and it's not looking very good. So we need to, do as much as we can to ensure that our political parties are committing to, to invest adequately on non-communicable diseases. So we have engaged them, and I can tell you that I'm just coming from the health committee of the NDC. We met them at their head office to have an elaborate discussion on our manifesto and what we think, are some of the things that we think are very critical and very crucial that when they, implement it to reduce the NCD burden. So they receive us very good. And we are hoping that, it will not be a rhetoric, it will not be just, a talk shop, but indeed when they get our mandates, they will be able to implement it. We've also met some few of them. Chairman T's party, for instance, we met him when he met the media, to also present to them our manifesto and then see how they can incorporate those one in his, in his bid to, to lead the country. We'll be meeting LPG, hopefully today, later in the day, just so we can continue to.
You've not mentioned the governing MPP, and because they are launching their manifesto this weekend.
Right. So let me say that I was coming to that, and we have submitted our manifesto to them already. They have acknowledged receipt. We've not had a sit-down conversation with them. This is something we are trying to see if possible we could do. But they received it and they acknowledged receipt that they would ensure that at least some of the things that we have, they would incorporate them. But we are still trying to see how we can have that kind of sit-down engagement with them. Last 4 years, for instance, we did the same. We couldn't meet all political parties. For instance, we couldn't meet the NPP. But when they assume, the office, they've implemented some of the things that we put in our manifestos. Though not all of them were captured in the manifesto. Okay. They did quite a number of things on non-communicable diseases, which we appreciate. But we need
you want more. Yeah. But so let's look at the specifics. What exactly do you want them to do?
Right. So indeed, non-communicable diseases. Currently in Ghana, 94,400 people die from NCDs every year annually.
Interesting.
And sometimes I get amazed. Look at the statistics. Almost about 100,000 people die annually from NCDs.
94,000
every year. In Ghana. And then, as you saw, 41 million people die globally, representing about 42% of global death. And in Ghana, 43, as you mentioned. But unfortunately, I wouldn't say road safety is not an issue. But whenever, whenever we hear the statistics about road safety, how many people, an average of 2,000 people dying annually from road traffic crashes, the whole country gets alarmed. But look at 94,000 people. This should be a national conversation. Indeed, we are told that the NCD will become the next epidemic after COVID. Because you would notice that when COVID hit, for instance, the people whose lives were being claimed by COVID were virtually people living with non-communicable diseases. The hypertension patient, the diabetes patient, cancers, all the chronic conditions that you can mention. So the statistics is very staggering. And the earlier, as a country, and all of us, take a bold decision, to address it, the better for all of us. So some of the risk factors that is increasing the disease burden, you have alluded to some of them already. So the tobacco use, that is catching up with the youth. In fact, the prevalence of tobacco is very low in the country. It's about 3% prevalence, which is very good. But unfortunately, we are seeing more trending, tobacco products, cigarette products, the e-cigarettes, the shisha use. That is very, very difficult to regulate. The policymaker, the FDA, is finding it extremely difficult, to regulate, some of these products. And now it's all over the place. The youth are using it and are abusing it. And if you're not very careful, statistics tells us that a session of cigarettes, a session of shisha, is about smoking 100 to 200 sticks of cigarettes.
Wow.
Just about 45 minutes when you have the youth gathered around to smoke half shisha.
About 45 packs.
Yeah, yes. It's about 100 to 200 sticks of cigarettes.
Hey.
That they have smoked in a session. That is how dangerous shisha is. Unfortunately, the education is not going down well with our students, especially our university and then our senior high students, where they always want to have fun and they want to have shisha. Electronic cigarettes are also now with us. People are smoking, we know they are smoking because it's very glamorizing, very handy, like this one. It could be like an e-cigarette that I'm smoking. So these are now things that are coming up and it's increasing our disease burden. So we have highlighted all of this in our manifestos to see how policymakers can ensure that they're able to regulate these externalities. So the one thing I wanted them to do, which is very critical for us, is investment. Adequate investment at the health sector, because per the Abuja Declaration, it says that 15% of national budget should go to the health sector. I don't know why they even say 15% because I feel it's wholly inadequate. But unfortunately, the country has not been able to meet that Abuja Declaration. The closest we came was around 2011, where we were about 11%. But all this was 2006, 7. So the whole national budget, only about 6 to 7 is given to the Ministry of Health to take care of our health problems. So you can imagine the gap, and that's why we are having huge problems. Every now and then, renal problems, we are having people complaining about out-of-pocket payment, catastrophic, cost of, of medical expenses. So that's one thing we want political parties to commit to. At least, if we can't do at least, we should go by the declaration, what we have signed on to. To do 15% of national budget should go to national health. Should go to the health sector. Again, there's this conversation that we hardly speak about, and I think for this I would also urge, your radio station, your station, to take it up. The uncapping of the capped national health insurance.
Okay.
I know it has become a conversation, but surprisingly, this was legislated in Parliament.
Is it part of the things you're asking?
We're asking okay. Already we are hearing some of the political parties, I think the NCDs speak about that they are going to uncap it. Which is good. We love it. We appreciate that, because, in fact, if you are capping about 30% of what's supposed to go to national health insurance, then it's not going, it's been channeled to other areas. That means that we are not prioritizing our health sector. And here I'll blame all political parties, because it went to Parliament and they all passed it.
Okay.
So good news. We are hearing that there's going to be a review of uncapping it. So at least we can have a lot of resources, to the health sector. The other thing is, the primary health care. So I'm talking about primary health care. We need to, WHO have said that if we actually want to advance our health sector, we need to prioritize the health sector at the primary health care level. I'm talking about the facilities at the downtrodden, the rural communities where people have, access to road network. How do we bring the facility closer to them? And then how do we invest adequately in these areas? I know there are some interventions already ongoing, but we want them to commit to investing adequately so that people do not have to travel long distance to come to Kolebu or Kumasi, teaching hospital to seek the care that they need. How do we ensure that we decentralize the healthcare facilities so that at least we equip them? Because currently, you go to some of the facilities, you'll be amazed that even simple glucometers are not there, BP machines are not there.
So you're talking about equipping or decentralizing?
Yeah, equipping, and this one is one of the key things. And apart from that, we should.
But decentralizing how? I want to understand.
Yeah, so like for instance, we want to make sure we bring the first facility closer to the people.
The first class.
Yes, I'm talking about the first class hospital closer to the people.
Okay.
Already, like I said, we are doing something. There's this cheap compound thing that the government is implementing, where at least within about 200 catchment area, there should be a health facility where people can visit. Unfortunately, like I said, it is not working as expected. So we need to invest more into that, so that people do not have to travel from my village somewhere in Impaha, and then travel to a district hospital or to come to Accra to access some facility. It's unbearable for many people to do. The cost of traveling alone, is very unbearable. So how do we bring healthcare closer to the people? That's another issue that we are also tabling. The other one is earmarking. When I talk about earmarking, in all of this, you need money. How do you get money to support?
But someone will ask you, with the Agenda 111, isn't it getting to the people?
We are seeing some infrastructure, but we've not seen the operationalization of this. So what we are saying is that, yes, Agenda 111 is a perfect, good idea. But the point is that when you already have some facilities like cheap compounds, already dying, some of them are not having the we can reduce the number of the Agenda 111 and then see how we can invest resource that they call the other hospitals. Because you go to the hospital, the BP machine, just check your pressure, it's not there. That's why you're having cardiovascular diseases, you're having hypertension being higher, in terms of the discussion. And if you're not able to tackle hypertension and diabetes, our problems will not be solved. Because currently, people are working, but they are dead because they don't know their BP level. They don't know. That's why every now and then you hear that somebody is dead. What a shock. What a shock. And these are people who are dying below the age of 40 years, below 40 years. Go to the community level, do it weekend. You find people, all their obituaries, our team youths are going, they are dying because we are not promoting public health. The other thing that we want to talk about, I mentioned the earmarking. We need to earmark some of the funding that, and government is currently recouping from, excise taxes. When I say excise taxes, I'm talking about taxes on healthy commodities. And that's one of the things that we need to look at. Because you mentioned the tobacco, alcohol, and then sugar-sweetened beverages. The point for us is government needs to ensure that we are able to reduce the importation and also the usage of these products. Because these are the problems of our world today. Tobacco, alcohol, sugar sweetened beverages. If everyone is able to reduce these products, then the better for all of us. Because most of the diseases that we are recording nowadays is from unhealthy commodities. They're eating late, bad oils, fats, and then this fat joint that we...
This eating late thing.
Yes, so we need to work on them because you need food to work, but you eat and you go and sleep. For example, so you need food and get energy to work. So once you're not going to sleep, why do you need food again? You don't need food to go eat it to go and sleep.
How long would you have to do that to expose yourself to it? Because I eat quite late.
Yeah, and that's difficulty. So you don't have to eat late and go and sleep. Eat. That's why they said 3 things. In the morning, eat like a king. Eat the bankus, the gobe and stuff. In the morning, eat like a king. In the afternoon, like a queen. In the evening, like a papa.
Okay.
Just something little, just to...
But in case I eat, how many hours do I need to sit up, before I go to bed?
Yes. So the point that
don't eat. Okay.
Just don't eat and go. But when you close from work, get something. Once you are going, at least you'll be able to bend those things as you walk along. And then the other thing I will talk about is the fact that our infrastructure, which is causing our road traffic crashes, is also very unbearable to us as a country. We are building new roads, but it's not meeting the standard, the smart city standard. And these are all contribute to non-communicable diseases. Okay. There's a standard that road traffic crashes or the Ministry of Road and Highways have to follow. Where every road should meet a standard, global standard. Where you have the walkway, you have the cycling way, and all the beautiful things that come with it. Unfortunately, we don't have them. That's why people are becoming very lazy to even train. Because someone will tell you that if I decide to go and train, whether I'm using a bicycle or something, I would be crashed by a car, and then I'll find myself dead because we don't have, those things. One of the safest places I could say is, when you go to the, Legon, people are able to train there and stuff. Unfortunately for us too, many of our community playgrounds have been diverted into astroturfs. I'm not saying astroturfs are not good, but the point is that it's making most of our youth not get a comfortable place to go and train. Where those days we can just walk and go and play football have all been sold with a private man, and you need to pay money to be able to access. So the point is that how do we ensure that we make it flexible so that the youth in the community can easily enter the place and go and play? But
I know the astroturfs are for the communities. And I know they use them because I'm from the Western region. A lot of the places that I know that are astroturfs, the youth play there almost every day. Yeah. They go to train. Okay, so there are places that I know that you have to pay. Okay. Before you assess the place. Maybe we need to review all of this to make it more accessible to the youth. Okay. Because they lock it up. That's what I know. Yeah. I know you need to maintain the place. Yeah. But you also need to make it available for our youth. That's how we're able to grow our sports. So more exercising. Make it more available so that people can exercise. Now the other thing I want to also mention is the fact that I mentioned about the physical activity. That's very critical. Yeah. That we need to encourage more physical activity in ourselves. Because one of the best things that you can do, is physical activity. The WHO Director for Health, Tedros, he's walking the talk. There's no single event that he hosts without having a global conversation around physical activity. Exercise. Yeah, so we need to. So we put all of this in our manifesto to ensure at least government is able to do all of these things. But more importantly for me is the earmarking of the excise duty amendment. The funding that we are getting from excise tax. So we can channel it to the health sector. On my way to work, driving in traffic, a vehicle just blew out, very huge. There was too much smoke from it, the exhaust pipe. How about that? The quality of air that we are breathing, especially in the city of Accra. When you go to my village, Buzia, you are sure to get the quality air because there are no factories, there's no overcrowding, but in the city. Right. So you didn't mention that because one of the risk factors for non-communicable diseases, so we have tobacco use, alcohol, unhealthy commodity, and then also physical inactivity. The last one is
is air pollution. In fact, it has been recognized as one of the major risk factors for NCDs, especially for people with respiratory conditions, for instance. You know, when you are blessed, you have a car and you are passing, you roll your but how many people have their cars? So we are left in the mercy of the smoke and stuff. So the point is, yes, that is why in our manifesto we've been talking about that government need to ensure that we are able to sanitize our air. You know, but now I think it's even better. Those the Abugboshi. You know, research says that people around Abugboshi area, were burning the ties and stuff for our wele and all of those things. You know, it increased respiratory conditions for people around the area. But thankfully, there are no more there. So at least we can have some level of, But the point for us is if we continue to import overused cars, we'll continue to have these problems. Okay. In some countries, you'll be traveling, you hardly see a car with fumes. And these are some of the things that our regulatory officials should be checking. So that when your car is burning these fumes, you can be arrested and go fix it because it can be fixed. But people, because they don't know the impact of it, they allow this to expose all of us to all these problems. So indeed, the dust and the pollution in Accra is very, very high. I'm told that there's a way we measure, and indeed, the quantity of dust that we are consuming every day is very, very huge. Not only the cars are doing that, even our road networks. Because once your road network is bad, then the possibility of dust coming into your homes and then creating more problems for you and your kids is also very huge and alarming. So yeah, so indeed, we are also having discussion with the DVLA and also the National Road Traffic,
roadworthiness, eh?
Yes, to ensure that at least they're able to reduce, find people. We have this emission
levy.
For me, I was not comfortable with the emission levy. The point for me is, let us be more practical. Let's see those, if people are, before you bring your car to this, let's check all of those things. If somebody is on the road and the car is blowing, out of exhaust, fumes, we should arrest the person. Okay. And then let the person go fix it. So the person can be on the road. So otherwise, we will continue to have problems that we can easily solve as far as issues of NCDs are concerned, because some of them are very easy to fix, especially on health promotion, which probably will be the last thing I want to speak about, health promotion and then health literacy. Okay. Government should deliberately, invest in health promotion, because if you don't know about the fact that inhaling smoke from exhaust fume will cause you problems, you'll be sitting on the road and you'll be But when people are aware, we will all demand that the right thing is done. If we are all aware that smoking is too bad for our system, alcohol use can impair our vision when we are driving. It can also give us the chronic condition we're talking about. We will support government in reducing the taxes and then also reduce or prevent or stop giving them incentive when they want to set up in our part of the world.
Okay. All right. And I'm sure that, those I was traveling with this afternoon on our way to work, I've asked you questions for you about the exhaust fumes that we inhaled in this afternoon. But thank you for passing through, and I wish you all the best, sir.